Visit www.faringfertility.com to download a printable version of the Menopur Injection Training Guide, also available in additional languages. Hello. Today I'm going to walk you through how to properly inject Menopur at home. I'm here to show you step-by-step instructions to help make the injection process easier. You are going to take care of a couple of things before injecting. There's assembly, mixing, and preparation. You will learn how to mix Menopur with sodium chloride using the Q-cap vial adapter, how to prepare the injection, and finally, how to inject your medication. I realize you may be nervous, but this will become more straightforward as I go through the steps. So let's get started. First, you are going to get ready. You will assemble your supplies, which include Menopur, sodium chloride, and the Q-cap. Start by washing your hands with soap and water and drying them with a clean towel. Make sure you wash them well. Also, make sure you place all of your necessary supplies on a clean surface. To get your Menopur injection ready, you'll need 1 or more vials of Menopur, depending on your prescribed dose, 1 vial of 0.9% sodium chloride USP used for mixing the medicine. Be aware the label color may vary. 1 sterile syringe, 1 subcutaneous injection needle, 1 Q-cap adapter for needle-free mixing, some alcohol pads, rubbing alcohol, gauze, and a sharps disposal container. When you have assembled all of these items and your hands are clean, you are ready to go. Tip: always take Menopur exactly as directed by your doctor. Okay, check your vials of Menopur for powder or a pellet. Also, check your sodium chloride vial to make sure that the liquid is clear and does not contain any particles. If you don't see powder in the Menopur vial, or if the liquid in the sodium chloride vial is discolored or contains particles, do not use the vials and call your pharmacist or healthcare provider. Then go on to your Q-cap blister pack package to check if it is intact. Do not use the package if it is damaged. If all your vials are good to go, remove the plastic caps from the vial of sodium chloride and from each vial of Menopur that you'll be using right now. So, if you're prescribed 2 vials a day, remove the caps from 2 Menopur vials and so forth. Go ahead and wipe their tops with an alcohol pad and allow them to dry. Do not touch the tops of the vials after you have wiped them. Place the vial of sodium chloride on the table, then open the Q-cap blister pack by peeling back the lidding. Make sure not to take the Q-cap out of the blister pack and not to touch the spike or connector ends. Now you are ready to fill the syringe with the sodium chloride. After connecting the Q-cap to the sodium chloride vial, you'll extract the sodium chloride from the vial into the syringe. Begin by holding the sodium chloride vial with one hand. With your other hand, hold the sides of the Q-cap blister pack, turn the blister pack over and place it on top of the vial. Push the Q-cap straight down into the rubber stopper of the vial until the spike pierces the top of the vial and snaps into place. If the Q-cap falls out of the blister pack, do not use it. Instead, throw it away and use a new one. Now you can remove the blister pack and throw it away in the household trash. Tip: be careful not to touch the connector end of the Q-cap. Next, take the syringe and pull down on the syringe plunger rod until you have reached the line that corresponds with the amount of sodium chloride that your healthcare provider recommended. This is usually 1 milliliter, but always use the amount your healthcare provider told you to use. Be very careful not to touch the syringe plunger during this step. Then place the tip of the syringe into the connector end of the Q-cap and twist the syringe clockwise until it is tight. But be careful not to over-tighten the syringe. Now that that's done, slowly push down on the syringe plunger to push air from the syringe into the vial. Keeping the syringe and Q-cap together, turn the vial upside down, then pull down on the syringe plunger to withdraw the prescribed amount of sodium chloride into the syringe. Separate the Q-cap and syringe from the vial by pulling up on the syringe barrel. However, be careful not to pull the plunger to remove the Q-cap. Now, throw away your sodium chloride vial in the household trash. Even though there will be some sodium chloride left in the vial, it is best if you discard the vial in your household trash and use a new vial for your next injection. Okay, time to mix your first vial of Menopur. Now you'll combine Menopur with sodium chloride, you'll transfer the mixture into the syringe, and you'll repeat these steps with the prescribed number of Menopur vials. Hold the vial of Menopur powder in one hand and the sides of the syringe with your other hand. Place the tip of the Q-cap over the top of the vial and push the Q-cap into the rubber stopper of the vial until it stops and snaps into place. Tip: be very careful not to push down on the syringe plunger during this step. Ready? Slowly push down on the syringe plunger to push the sodium chloride into the vial with the Menopur powder in it. Then gently swirl the vial until the Menopur powder is completely dissolved within the sodium chloride. It is important to swirl the vial to make sure there are as few bubbles as possible in the liquid in order to get the correct amount of medicine. Tip: do not shake the vial as this will cause bubbles. As soon as the Menopur powder is dissolved, and make sure it is completely dissolved, push the plunger down to empty any remaining air from the syringe, then turn the vial upside down and pull down on the plunger to withdraw all of the Menopur into the syringe. Be careful not to pull the plunger stopper all the way out of the syringe barrel. If your healthcare provider tells you to use more than one vial of Menopur, mix your first vial of Menopur powder with sodium chloride, but do not inject your dose yet. Instead, use the liquid in the syringe you've just mixed to mix the next vial of Menopur. Tip: you can use the liquid in the syringe to mix up to 5 more vials for a total of 6 vials of Menopur. Your healthcare provider will tell you how many vials of Menopur to use. This is the part where you prepare your injection by attaching your needle to the syringe and choosing an injection site. Once you're finished mixing the last vial needed for your injection and have withdrawn all the medicine into the syringe, you're ready to remove the syringe from the Q-cap. Do this by twisting the syringe counterclockwise while holding the Q-cap steady. Be sure to throw away the Q-cap with the attached medicine vial in your household trash. Tip: use the needle your healthcare provider has advised you to use for your injection. Okay. Now, while holding the syringe with the syringe tip pointing up, place the needle onto the syringe and gently push down on the needle and twist it onto the syringe in a clockwise direction until it is good and tight. Great. Do not remove the needle cap until you are ready for your injection. Now, carefully set the syringe with the needle down on the table. I will show you how to perform a subcutaneous injection, which means an injection below the skin. It's fairly simple. Lots of people who are not doctors or nurses do it. You'll want to select an injection site on your lower abdomen 1 to 2 inches below the navel. Clean your chosen site with an alcohol pad and let it air dry. Tip: be sure to inject in a different site, alternating between the left and right sides of your abdomen each day to help reduce soreness and skin problems. Finally, you'll inject Menopur. This involves checking for bubbles, injecting your medication, soothing the site, and cleaning up. Carefully remove the needle cap from the syringe. Hold the syringe with the needle pointing straight up. Now pull down slightly on the plunger and tap the barrel of the syringe so that any air bubbles rise to the top. Press the plunger up slowly until all the air is out of the syringe and a small drop of liquid can be seen at the tip of the needle. Tap the syringe to remove that drop of liquid. Tip: to keep it sterile, do not let the needle touch anything. Okay, all the hard work is done. Now you are ready to inject your medication. Injecting your medication, or even the anticipation, may seem scary, but with the right technique, which I am going to demonstrate here, you'll see that it's really not as bad as it seems. Let's go through the steps to help you inject Menopur with confidence. Hold the syringe in one hand. Use your other hand to gently pinch a fold of clean skin where you will insert your needle. Hold the skin between your thumb and index finger. Hold the syringe at a 90-degree angle to your skin and quickly insert the needle all the way into your skin fold. Push down the plunger of the syringe with a slow, steady motion and keep pushing until all the fluid is injected into your skin. Release the skin fold and gently pull the needle out. If the site is bleeding, place a gauze pad over your injection site and gently apply pressure to stop the bleeding. Do not rub the site. If the site is sore or red, apply ice to it for 1 minute and take it off for 3 minutes. You may repeat this 3 or 4 times if needed. Tip: do not rub the site, as this may cause aggravation. Discard all your used needles, syringes, and injection materials in an FDA-cleared sharps disposal container right away once you're done with the injection. You should always discard your vials, even if there is some liquid left in them, as Menopur must be used immediately after mixing. Please see the Menopur patient information and instructions for use if you do not have an FDA-cleared sharps container and for additional information on proper waste disposal. Tip: to prevent injury, do not throw away loose needles and syringes in your household trash. Menopur, Menotropins for injection. Menopur, Menotropins for injection, is a prescription medicine that contains hormones. Menopur contains follicle-stimulating hormone and luteinizing hormone activity. These hormones stimulate healthy ovaries to make eggs. Menopur is used for women who need medical help to get pregnant. Your doctor may prescribe more than one medicine as part of a pregnancy plan. Important safety information. Do not use Menopur if you have ovaries that are not able to make eggs even with the use of hormones, are pregnant or think you may be pregnant, have problems with your thyroid gland or adrenal gland that are not controlled by taking medicine, have tumors in your female organs, including breasts, have a tumor of your pituitary gland or any other tumor in your brain, or have heavy or irregular vaginal bleeding and the cause is not known. Do not use Menopur if you have a known previous allergic reaction to these medications. Menopur may cause serious side effects. They sometimes stimulate the ovaries too much. This is called ovarian hyperstimulation syndrome, OHSS, and can be a serious medical problem. OHSS may cause pelvic pain or breathing problems, or it may make you urinate less. In rare cases, patients with this problem have had serious lung problems. Menopur can also cause blood clots and strokes. Call your doctor or get medical help right away if you have severe pelvic pain, nausea, vomiting, diarrhea, sudden weight gain, trouble breathing, or decreased or no urination. Menopur may cause pregnancies with twins or more than 2 babies at the same time, miscarriages, birth defects, and pregnancies located outside the uterus. Do not use Menopur if you are nursing. The most common side effects with Menopur are headache, stomach pain, and upset stomach. Sometimes there is an injection site reaction that can cause bruising, pain, or redness. Please see full prescribing information for Menopur at www.fairingfertility.com. Well, that's it for today. Thanks for tuning in, and come back again if you need an injection refresher. And be sure to visit www.fairingfertility.com to download a printable version of the Menopur Injection Training Guide, also available in additional languages.